Hi everyone, welcome to today's session. My name is Onyinye, and in the house with me we have our very own Sabi Doctor. Sabi Doctor, how are you doing?
I'm doing fine. Thank you for having me on the show.
You're welcome. So today we'll be talking about malaria, and just to dive into it, Sabi Doctor, what is malaria and why is this still a public health issue even in 2025?
All right, so malaria is a life-threatening parasitic disease that is caused by one very shameless parasite called Plasmodium. And this parasite is transmitted primarily by mosquito, the female Anopheles mosquito. And as we know, malaria is a life-threatening condition. And we know that it has killed millions and possibly billions of people since the dawn of malaria. Currently, it kills about 600,000 people annually. And it's interesting because about 95% of the mortality is actually in Africa. Also, 75% or about 76% of those who lose their lives on account of malaria are children under the age of 5.
Yeah.
So it's still a major issue that needs tackling at all levels.
Okay.
As to why it is still a global health problem in 2025, there are a number of factors. Number one is the factor of climate. It's believed that climate change is also affecting the persistence of malaria. Another one is the issue of drug resistance. The malarial parasites are becoming resistant to routine drugs that were hitherto very effective for the treatment of malaria. So that's another major one.
Okay, so we know that it's mosquito bites that do transmit malaria, right?
Yes.
So, are there other ways that malaria can be transmitted apart from when mosquito bites someone?
Okay, so the fact is, it is possible that one can become infected with malaria even though they have not been bitten by a mosquito.
Oh,
Yes, there is a possibility that somebody can get malaria through blood transfusion, although this is not a commonly encountered event, but it can happen. So, somebody who is infected with malaria donates blood, that person who receives that blood can become infected as well.
okay.
Another one is the transmission that can happen through organ transplantation. So the parasites, to a very large extent, when it gets into the human system, localizes in the liver
Okay.
and it can remain there sometimes for months. Now, if it happens that somebody donates their organ and that organ has malaria, the recipient of that organ can become infected. Then there is also the transmission that can happen from mother to child during pregnancy. In fact, it's one of the reasons why we emphasize on malaria prevention in pregnancy.
Okay, you mentioned that malaria can remain in a person's system for months.
Yes.
If I have the parasites in me and I'm not having showing symptoms, maybe like immediately, could it be like maybe over the years, over the month? Is there a possibility, especially if I'm not within an area that malaria is not really prevalent and all? So is there a possibility that I could still get malaria even if I haven't been in a place?
That's an interesting question because I did a post on this particular question some time ago, and I was primarily addressing our Japa audience who leave Nigeria and go to places like Canada, UK, where you have little or no malaria attack there. If it happens that you are living malaria endemic region like Nigeria and going to say Canada or elsewhere where malaria is not endemic, it is still possible that you can get there and develop malaria. And it boils down to this fact I just explained now, that malaria can remain dormant in the body or in the system for months or even years. Okay. So you can leave Nigeria here with the parasite in you, get over there to Canada, and maybe 9 months or 12 months down the line, you might develop malaria. For that reason, I have often advised our Japa brothers and sisters that when they are leaving Nigeria, they should endeavor to carry with them anti-malarial drugs in the event that they develop an infection.
So like they've not escaped
They have not escaped.
That's so funny. Okay, so we've talked about how it can be transmitted. So what about the treatment plan? What's available right now in treatment of malaria if someone has one?
Just before we get to the treatment, permit me to talk or hammer a bit on the symptoms. let's talk about signs and symptoms very briefly, and then we can get to treatment. All right. So, how does a person know that they have malaria? Commonly in our environment, they will say, I have fever, or
Yeah.
my mouth is bitter, and then they say they have
Yeah.
malaria. But it's important to know that malaria is not the only cause of fever. There are
Yeah.
other things that can cause fever. In fact, even bacterial infections can cause a fever as well. So we should be very careful with brandishing that word fever all over the place. Having said that, yes, it's true, malaria can cause fever. Malaria can cause joint pain. Malaria can cause fatigue. Malaria
Okay.
can cause loss of appetite. Malaria can cause chills. These are some of the common symptoms of malaria. Now, if you are having symptoms that mirror the ones I've just mentioned, you may want to get tested and confirm whether or not it's a case of malaria and then get it treated.
Okay, so you mentioned fever as
Mhm.
the number one, yeah, because I know that once anybody has fever, the first thing on everyone's mouth is malaria. So is there a possibility that there is no fever and you know and malaria can still happen?
Absolutely. It's important that people understand the mechanism of the fever that arises during malaria or any other infection. Oftentimes, it is the immune response of the body against the infective
infection
agent
that's
that
happening.
brings about the fever.
Okay.
So, what if one does not have a solid immune system? So, for example, now the case where the person is immunocompromised, maybe the person has HIV and AIDS or
Okay.
something along that line, and their immune system cannot mount a favorable or competent response against that. It is possible that the person can have malaria and not have fever, or the fever can be very, very mild and
Okay.
easily discounted.
So I want to ask this question. I know that in our environment here, once, like you said, one has a fever and chills, they just quickly treat for malaria. That kind of practice, is that advised? Do you advise people to get tested first rather than just
Go to
since
the
it's-
pharmacist
since
and
a-
just buy.
yeah, since a very
Yes.
common this
Yeah.
thing.
In fact, that's a problem. We are beginning to see a case of drug-resistant malaria. But there is now multi-drug resistant malaria. Routine drugs that used to clear the parasite
Parasites.
from the system are no longer doing the job as they used to do. And one of the reasons why drug resistance can happen is the abuse or indiscriminate use of anti-malarial drugs.
Okay.
So it's important that people get tested so that you don't just use drugs indiscriminately. Because remember, I said it is not only malaria that can cause a fever, it is not only malaria that can cause headache. It is not only malaria that can make your joints to ache, that can make you lose appetite or anything.
So bitter mouth.
It's not only malaria that can do that. So it's important that if you are having symptoms and you suspect this is malaria, just go get tested. In fact, I understand now that there are rapid diagnostic kits that you can get and use. Like 15 minutes,
yes.
you know whether or not you have malaria parasite inside of your system.
Okay, so what would you say is the preferred protocol in the treatment of malaria if someone has the symptoms?
Then the next thing to do is for you to get tested.
Okay.
Now, you are tested positive for malaria. How do you treat?
Yeah.
There are available drugs. The common one right now that is being talked about the most is the artemisinin combination therapy. For example, the Lonart that we so much talk about, right?
Yeah.
So treatment with Lonart can eliminate the parasite to the point where the person is fully covered.
Is it possible to go from uncomplicated to complicated?
Absolutely.
Or, I mean, if someone has malaria, they just go to the complicated one. Are there cases
Okay,
like that?
let me explain something very important here. There are people who are more prone to developing complicated malaria. Children who are under 5, pregnant women, people who are living with HIV.
Okay.
These are people, or these are at-risk population. Why are they at risk? Because to a very large extent, their immune system is not robust. So these are at-risk population.
But is there a possibility that one who is not in these categories you just mentioned can have complicated malaria?
Yes, absolutely. If you have malaria, you don't treat it, it can progress to complicated malaria. So certainly that can happen.
Okay, so I mean, we've talked about the treatment. So that ways we can prevent even having the malaria in the first place.
In medicine, we have this saying that prevention is better than cure. Yes. So it's best for people to aim to prevent it. And how can it be prevented? Number one, you can target your interventions to limit exposure to the vector, which is the female Anopheles mosquito. You want to clear off stagnant water bodies, the clearing of bushes, using insecticide spray, mosquito net, wearing of long-sleeved clothing when you are outside or you are outdoors, mosquito repellent. They apply it on their bodies. By the way, do you know how those things work?
Not really.
All right. So it is known that mosquitoes can actually perceive human odor.
Oh.
Yes, and
Like that.
the repellent can help distort that mechanism.
Oh.
That way, they might not be able to easily identify that, okay, this person is a human being.
So, Sabi Doctor, we've heard that some blood groups are more susceptible to malaria. So how true is that?
The science is very clear on that. We are aware that people who have blood group A and blood group B are more likely to suffer severe malaria attack.
Okay.
Again, people who are AA, genotype AA, are more likely to have severe forms of malaria compared to individuals with AS and SS.
So there's some truth to it.
Yes, there is. The science is very clear about that.
Okay.
Yes, absolutely.
All right. So what about the ones that say mosquitoes only bite at night? What do you have to say about that?
The truth is that mosquitoes are more active at night, but that is not to say that they cannot bite during the day. They can bite you during the day, but they are much more active at night. And the reason is because, to a very large extent, most people by nighttime, they are all relaxed, they are chill, they are not moving around, and it just makes the biting process a lot easier for the mosquito.
Okay. What about, is it true that if it only takes one bite for you to have malaria?
Yes, a single bite is enough to cause an infection.
Are there vaccines available for prevention of malaria?
As of today, there are 2 vaccines available: the RTSS vaccine, the R21 vaccine. In fact, I think last year Nigeria received about 1 million doses of the R21 vaccine. This particular one, the R21 vaccine, is showing a lot of promise. 75% efficacy, can provide cover for up to 2 years.
Is this vaccine for everyone or maybe just children?
For now, the vaccines are primarily for children between the months of 5 and 36.
Yeah, that means there's light at the end of the tunnel, right?
Absolutely.
It will really bring down the mortality rate that we have.
That is what we expect, and that is what we are hoping to achieve eventually.
That is amazing. Wow, guys. I mean, this session has been like an eye-opener for all of us. And I'm sure that we have learned 1 or 2 things about malaria and even the progress of how it can be well prevented and treated and bringing down the mortality rate that we have now. Thank you so much, Sabi Doctor, for helping us to understand what it is right now. We appreciate you.
Pleasure is mine.
We want to also thank our sponsor, Lonat, for this session. With that, we'll be bringing it to an end till we come your way next time. Bye.